Your tongue is broadcasting signals about your heart, your liver, and your gut right now. Signals that, according to a 2024 study, can predict disease with 98% accuracy. Most people look at their tongue every single morning and see absolutely nothing. By the end of this video, you'll know exactly what to look for, what it means, and a simple protocol your doctor has likely never mentioned. This isn't ancient folklore. In August of 2024, engineering researchers from the University of South Australia published a breakthrough, an AI imaging system that diagnosed diabetes, stroke, anemia, liver disease, and gastrointestinal conditions, all from a single image of the tongue. They trained their algorithm on 5,260 tongue images. The accuracy? 98%. And here's what most people don't realize. This technology isn't inventing something new. It's simply validating something your body has been doing all along. Think of your tongue as a biological billboard. It's one of the most densely vascularized organs in your entire body, packed with blood vessels that sit just beneath an incredibly thin layer of epithelial tissue. This means changes in your circulation, your blood oxygen levels, and your systemic inflammation show up here first, sometimes months before they appear anywhere else. But there's more, and this is the part that changes everything. Your tongue is also home to one of the most complex microbial communities in your body. A 2024 study published in Frontiers in Artificial Intelligence mapped the tongue into 4 distinct zones, each corresponding to a different organ system. The tip of your tongue reflects your heart and lungs. The edges, those are your liver. The center connects to your digestive tract, and the back, near the root, is tied to your kidneys. Now here's where it gets really interesting. Scientists have confirmed something called the oral gut axis. In 2025, researchers demonstrated that the bacteria living on your tongue coating directly mirror the bacteria residing in your gut. When your gut microbiome shifts from poor diet, chronic stress, or inflammation, your tongue coating changes in lockstep. Your tongue is not just sitting in your mouth. It's a real-time readout of what's happening deep inside you. So what happens when this system goes wrong? Stay with me because this next part might explain symptoms you've been living with for years. A purple or bluish tongue can signal cardiovascular insufficiency. Your heart isn't pumping oxygenated blood efficiently. Researchers presenting at the European Society of Cardiology found that chronic heart failure patients consistently showed redder tongues with a thick yellow coating. The microbial composition on their tongues was so distinct that 5 categories of bacteria could distinguish heart failure patients from healthy individuals with 84% predictive accuracy. Now, a yellow tongue with a greasy coating, that's often your liver waving a flag you've been ignoring. A 2025 clinico-pathological study found that color values at the tongue's edge, the zone corresponding to the liver, correlated directly with the severity of liver steatosis, lobular inflammation, and fibrosis. The worse the liver damage, the more pronounced the tongue color shift became. And that thick white coating you might be scraping off every morning, it's not just bad breath. Research published in BMC Microbiology confirmed that tongue coating thickness directly reflects gut dysbiosis, an imbalance in your intestinal bacteria that's been linked to bloating, brain fog, stubborn weight gain, and metabolic dysfunction. If you've been dealing with fatigue that sleep doesn't fix, digestive discomfort you can't pin down, or brain fog that makes you feel like you're operating at half capacity, your tongue may have been trying to tell you something for a long, long time. But here's the good news, and this is exactly why you're still watching. You can use this information starting tomorrow morning. Here is your 4-step tongue check protocol. Step 1, the morning inspection. Before you brush your teeth, before you drink anything, stand in front of a mirror and natural light. Stick your tongue out and look at the color, the coating, and the shape. A healthy tongue should be pale pink with a thin, clear white coating, not thick, not yellow, and not deeply red or purple. This is your baseline. Step 2. Check each zone using the map you just learned. Is the tip purple or bluish? Prioritize cardiovascular support. 2 grams of omega-3 fatty acids daily from wild salmon, sardines, or a high-quality fish oil supplement. A 2022 randomized controlled trial in the American Journal of Clinical Nutrition found that this dosage significantly improved endothelial function in adults over 45 within just 12 weeks. Step 3. If you see a yellow, greasy coating along the tongue margins, your liver is asking for help. Reduce alcohol to no more than 2 drinks per week. Add broccoli sprouts to your meals. They contain sulforaphane, a compound that directly activates liver detoxification pathways. And consider milk thistle extract, 200 milligrams 3 times per day, a dosage validated by a 2020 meta-analysis published in Phytotherapy Research for reducing elevated liver enzymes. Step 4 addresses that thick, white coating and the gut dysbiosis behind it. Increase your fiber intake to at least 30 grams per day. Asparagus, artichokes, lentils, and ground flaxseed. These feed beneficial bacteria like Bifidobacterium and Akkermansia. Keep added sugar under 25 grams daily. A 2024 study in the journal Gut found that this exact fiber and sugar combination reshaped the oral gut microbiome in as little as 3 weeks. Do this consistently for 2 weeks, and here's what begins to happen. Your tongue coating thins, the color shifts toward that healthy pink, and in many cases, the bloating, the fog, and the fatigue begin to lift. Most people stop at the tongue check itself, but researchers stumbled on something almost by accident that can accelerate everything you just learned. Tongue scraping, done correctly. A 2023 randomized controlled trial in the Journal of Clinical Periodontology found that gentle tongue scraping with a stainless steel scraper performed every morning before eating or drinking reduced inflammatory markers on the tongue surface by up to 40% in just 1 week. The mechanism is simple. You're removing the biofilm where pro-inflammatory bacteria accumulate overnight, interrupting the oral gut cascade before it even starts. 5 seconds every morning. That's it. That's the bonus most people never discover. Your body has been talking to you. You just weren't taught the language. Tomorrow morning when you walk to that mirror, you're going to see something most people go their entire lives never understanding. 5 seconds. 1 look. That's all it takes to catch a problem before it becomes a diagnosis. Because this isn't just about living longer. It's about being fully present, fully vital for the people who need you most. If this helped you understand your body in a new way, subscribe, because next week we're covering the hidden link between your fingernails and your metabolic health, and it connects directly to what we just discussed. Drop a comment below. What did your tongue reveal this morning? And if you found this valuable, hit like. It genuinely helps this reach someone else who needs to see it.